Hi, so today let's discuss about the first trimester of pregnancy. What to expect, what are the warning signs, and what is the care to be taken during the first trimester of pregnancy. The first trimester refers to the first 12 weeks of pregnancy. So, right from the time your urine pregnancy test is positive until the completion of 12 weeks. During this first trimester, a lot of changes happen in your body, and also you may have multiple symptoms like nausea, vomiting, a lot of fatigue. You may not feel up to it. You may not feel like doing all the activities that you used to be able to do earlier. At the same time, you may feel slight breast tenderness as well. Overall, this period is different for different individuals. So, some people may not have nausea at all, while the others may struggle with severe nausea and vomiting. As the pregnancy goes forward, the nausea and vomiting subsides for 90% of the pregnant women. The other important thing to remember in your first trimester is taking your supplements correctly, the folic acid, vitamins on time daily, getting your early pregnancy scan, and also finally your NT scan between 11 to 14 weeks. During this scan, essentially the baby is screened. We look for any soft markers that are indicative of any defects or any syndromes in the baby. Now, what are the warning signs or symptoms for which you need to approach a gynecologist or for which you need to be careful? First is excessive vomiting, where you're completely dehydrated or you're not able to tolerate anything orally. You're not able to drink or eat anything. You're not able to keep any food down. There's constant vomiting. This is the first sign for which you need to approach your doctor or your gynecologist. This is the first symptom for which you need to visit us. The second, if you have any signs of bleeding. Sometimes in early pregnancy, you may have slight spotting or slight bleeding, which is called as implantation bleeding. But this is always a warning, an indication that you need to visit us. Sometimes it may be nothing and we just need to confirm that everything's okay on ultrasound. At other times, there may be a small bleed or a collection inside the uterus, just below the sac. In such cases, we may need to advise rest, certain extra supplements, certain extra injections to make sure that this doesn't progress to an abortion. So these are two warning signs that you must be careful about: excessive vomiting and any bleeding or spotting in early pregnancy. Apart from that, you can continue slight walking, slight kind of exercises. If you've been someone who's exercising regularly, the same thing can be continued after consulting your gynecologist. Maintaining adequate hydration is very important. Trying to eat a balanced diet, which may sometimes be difficult because of the nausea, but as much as possible, try to have adequate amount of proteins and adequate amount of carbs in your diet. A balanced diet which includes fruits and a lot of green leafy vegetables and a variety of dry fruits is essential. So the first trimester is a relatively new feeling for a pregnant woman, and you may have mixed emotions. But the first trimester is relatively easy if you know what to expect and how to take care of yourself. So after looking at preconceptional counseling, how to confirm your pregnancy, the first trimester, we'll give you further tips and further information about what to expect in the second trimester, the third trimester, and finally during labor. Watch this space for more information.